So the CDS is the up-to-date system which we are using in our hospital presently. I would tell that we are looking for an integration with our EHR. So right now, the eClinical Works HMIS which we have been using, so the proper integration has not got possible. So what right now the doctors are using is more of using it as a reference material, which is very much comprehensive, very much useful for their decision making, for enhancing and augmenting the decision making whatsoever diagnosis of the patient is. So that is what currently up to date is doing for our doctors during the rounds and during the decision making towards the decision of the management plan of the patient. Right now that is the most commonly used indication by our doctors. Plus a lot of it is being used currently for teaching our postgrads. So we have postgraduates in all the departments at our medical college. So a lot of it, is being used by the students to learn, as in why this kind of a decision was taken by the doctor. What is the current guideline saying? What they have read in the books. So the entire understanding of that nexus, as in why this treatment plan was fixed, up to date is helping a lot into teaching them for their the enhanced learning, I can say. Yeah. So, see, what basically the doctors find most interesting in this is they can point down to whatever they are looking for. For example, broadly, I am looking for a particular diagnosis. After going to that particular disease, I want to pin down my search and my requirement to a particular thing. Like, for example, I'm looking for management plan in a particular aged patient in a particular disease scenario. Right now, being a tertiary care hospital, we have a lot of patients who are coexisting illnesses. So I have a patient who is suffering from diabetes, who is also suffering from an end-stage kidney disease, who is suffering from some kind of infection. So what up to date helps us is combining all these coexisting illnesses and coming to a final conclusion that what in such a patient would be the best thing to do. So there are a lot of flow charts and diagnostic algorithms as well as management algorithms in place, which help them decide that what would be the best in such kind of patients. What do books tell us is not a combination of the practical scenarios. The books would explain that what happens in a kidney disease patient, what happens in a diabetic patient. But when a situation comes when there is so much of situations coexisting, what to do in those situations, what do the current guidelines say, what is the current the antibiograms and the current national guidelines say. So that all being configured in the system, they help a lot in enhancing the decision making for the doctors. They also help a lot in resource intensively planning the laboratory investigations, that what would be the defined investigation which would help them to reach to the diagnosis appropriately. So that is one additional thing which is supported by the up to date system. I would rather have a suggestion here. I mean, for what we are looking more for it. So right now, what we are using is as a as I told, it's kind of a best reference material which we have, which is updated, which is very comprehensive, which is everything in place in a correct format. But what I would perceive as the head of an organization or as a doctor also, that there could be some mechanism by which we could configure entire of it in our digital system. Like we have a platform in which we have a diagnosis of a patient. So the basic patient details like my age, my sex, my demographics, my diagnosis is feeded, and the CDS is very much integrated with this information of the patient. As in, I as a doctor could feed the entire information on the start of the day, and the entire day and the coming days till when the patient is admitted with me under my care, I am in close contact with my up to date for this particular patient, right? So it is giving me a lot of suggestions, lot of thing like you have missed on this investigation, so that might be giving me an idea, as in I could go for another investigation. It could suggest me that this kind of drug interaction could take place, so you could better avoid this drug. So it is kind of an enhancer and augmenter for my decision makings, and it could be like a regular help for my patient when I have fed my patient's details into the system for as a doctor. So I have a login and I have fed my 5 patients under my care. I have fed all their details, and then it is augmenting my decision making all throughout the stay of the patients. So that is the level we want to attain with up to date. I'm very sure it's coming in, as we know that a lot of a merger is going to happen with the electronic health records. But as soon as it becomes patient specific, it would be more and more user friendly for the doctors, and they would definitely love to have such kind of a configuration in the system. See, so CDSS is all about adherence to clinical guidelines. It's all about evidence-based practice. So, as we all know that since last 2-3 years, we are seeing great changes in the trends of the various diseases we are seeing. Be it the upcoming diseases like COVID-19, be it the current new influenza variant which we are seeing, or be it the chronic diseases. I mean the hypertension and diabetes. We are seeing so many changes. Such kind of changes with all the evidences is not possible anywhere into books in a very short span of time. So having the presence of such a platform definitely helps in staying updated with what the current guidelines are saying, which is the guidelines are definitely made after combining so many things and so many resources from across the places, across the country, across the globe. So that definitely have builds up great insights for a decision maker to take into consideration several things which have been put up in the guidelines. So first important thing is that evidence base has become the crux and has become the grass ground most important thing for the doctors these days. Adherence to the clinical guidelines, as you very correctly said, that it is extremely crucial to stick to the guidelines. Definitely there are deviations. See, all patients are present with different scenarios. It's very difficult to pen down medicine into paper. A lot of it comes with experiences and what kind of what kind of presentation the patient has. It's all different. Every patient has a different story to tell. But again, having those guidelines and the presence in the platform is of a great use. Similarly, of great use becomes is safety. So prescribing the medicines appropriately, the dosages, the interactions, the adverse effects which could happen in a certain form in along with a certain drugs. So those things are also definitely very useful. Plus, as I mentioned earlier, that the resourceful laboratory investigations usage. So along with the adherence to clinical guidelines, it's more of safety and effectiveness in the healthcare which comes with the platform, and cost effectiveness, as I already mentioned. So there are multiple advantages along with the augmentation into clinical decision making.